I think our team is working with those lawmakers, and sometimes it's, we lead very, very loudly, and sometimes our leadership is behind the scenes to craft something where the votes might be there for.
That is from my conversation with White House OMB Director Russ Vought here at the Reagan National Defense Forum. Joining me now, Senator Bill Cassidy, chairman of the Help Committee and a key player in these health care negotiations. Senator, great to have you with us. I was talking with the director there about how involved the White House is or isn't in these health care discussions and negotiations. Can you give us some insight into that, whether the president may be interested in signing off an extension of the ACA subsidies or what other policy moves the White House might endorse?
I think the White House and Republicans are very much in favor of Americans having affordable health insurance. They want Americans to have access. And the president's given pretty clear guidelines. He wants money to go to patients and not to insurance companies. And so the kind of marching orders I've taken from the president is how do we offer our fellow Americans who are on the Obamacare exchanges and would be paying, in some cases, $33,000 for policies that have been set up by Democrats, an ability for them to have a lower premium and have money go to the patient, not to the insurance company, so that they have an account to help pay for their medical expenses. The president gave the marching orders. We're working on it, want to deliver it.
It will take time. Nobody is under the illusion, I think, that with 10 working days or so, maybe less, left for the Senate in this year, that an overhaul of the healthcare system or long-term solutions happen before the end of the year. So will there be some portion of this that would extend the subsidies? And I know that you are looking at this in the context of money funneling into health savings accounts, but will an extension go on while you try to figure out the policy?
Shannon, you nailed it. You can't fix everything by January 1, 2026. You nailed it. And so you got to work with what you have. Now, it's a political decision whether or not to continue the subsidies in some extent. But if we did continue those subsidies to a certain extent, you'd either be giving 100% of the money to the insurance companies, in which they take 20% of it for deductible and copay, or so only 80% comes back to the patient, 20% deductible and copay, or you give 100% to the patient. That's what the president wants to do. So if we do continue the subsidies, you can put that over here, 100% going to the patient, and put it into a health savings account. They get a cheaper premium, and they get first dollar coverage. They have money in their account to pay for their daughter's sprained ankle. Off the bat, that's a better thing. Let's give the American people a choice. And you're right, we got to do it by next year. We can do this by next year.
Okay, I want to read something from National Review talking about this proposal that would extend some of these subsidies, although in a different way, and whether you can get the votes together for that from both sides of the aisle. They write this: Republicans who are open to Cassidy's plan may be hesitant to sign on to any proposal that would keep enhanced Obamacare subsidy funding at current levels. And even if enough GOP senators warm to the plan, winning over enough Democrats to clear the filibuster's 60-vote threshold for passing legislation will be tricky. Where are you on bipartisan support for this idea?
So I've been talking to Democrats. There's absolute interest. I'd like to say that some of them, no American wants a fellow American to be able to afford health insurance. Now, we may disagree the threshold. The original Obamacare put the limit of a percentage of your income, I think, at like 9.8% or something like that. So we may argue about that. But if we can get to a framework where they give the American people a choice, they can stay with the policy they have with a $6,000 deductible, or they can go to another policy with a lower premium and money in a health savings account for them to purchase that which they do. The rest is just political decisions. What dial do you turn here, dial you turn there in order to get your votes? I think we can do this if people are of a goodwill. I say we don't want a Republican solution, a Democratic solution. We want an American solution that works for Americans. If my Democratic friends believe that, we can do it.
Well, it sounds like what they're going to offer up this week, at least from the minority leader, Chuck Schumer, he says there's going to be a clean 3-year extension of the subsidies that will come up for a vote this week on the Senate floor. Here's what he says about the political choice.
Republicans have only 1 week to decide where they stand. Are they going to vote for this bill and bring health care costs down for the American people, or block this bill and send premiums skyrocketing on January the 1st? That's what's at stake.
So in this political environment, with him laying it out, with that being the choice, can you get something substantive done?
As always, Chuck is wrong. The choice he is given is a false choice. The choice he wants to give the American people is a $6,000 deductible, a system which we send $26 billion to insurance companies, and they take 20%. They take 20% of it for profit and overhead. No, give them that choice. Okay, you want a policy with a $6,000 deductible, you got it. We want to give an additional choice, one in which your premium is lower and that you have money in an account to help pay for it. If he wants to give people that choice, I'm okay with that. But let's give them a side-by-side choice, both on the exchanges. The patient makes the decision, not Chuck Schumer. Let the patient make the decision. That's the way it should be. Let the American have the power. Let the patient have the power.
Okay, do you anticipate a vote on what you are proposing within the next week, a vote before Christmas?
I sure hope so. We're working to deliver to Leader Thune and Speaker Johnson a plan which I think could get 60 votes, which gives the American people the power, and they can choose a lower premium and an HSA. We're working on that, and I'll give them a piece of paper probably by email tonight.
Okay, I want to make sure that I get to you, too, about a vaccine change that, as somebody who's practiced medicine for decades, you have opinions on what's happening here. And so what we got this week was a recommended change to current policy when it comes to hepatitis B and that vaccination. In the past, it was recommended for all babies born here in the U.S., but there's a recommendation from the Advisory Committee on Immunization Practices this week. Here's some of the reporting on it. Reuters says the committee voted to keep the birth dose only for infants of the less than 1% of mothers who test positive for the virus. That replaces the universal suggestion from the past. Our colleagues over at FoxNews.com report it this way. The committee voted in favor of the recommendation, finding parents should exercise individual-based decision-making in consultation with the doctor. What about that idea of giving the parents the information, the decision, when it comes to this particular vaccine?
We already do. Let's give context. When this program started, this policy started, there are about 20,000. Let me say this. Since this policy has started, we've gone from 20,000 cases of acute hepatitis B in a child, 95% of the time becoming chronic, I'll explain that, down to 20 per year. Isn't that amazing? 20,000 to 20. And so what was made in 1991 was a recommendation, not a mandate, in which you would offer the mother the ability for her child to be vaccinated. Now, if you do that, because of those who are infected at birth, 30 or 40% of them, 95% of them become chronic carriers. So what does it mean to be a chronic carrier? It means that you're at risk for end-stage liver disease, for liver cancer, for infecting other people. But if you vaccinate at birth, that never happens. Yes, you can go and say, well, let's check the mother and see if she's positive, and if she's not, then we don't need to vaccinate the baby right off the bat. But the vaccine is safe, it's effective, and the hospital works better with the system. If the system is that every mother is offered this vaccine and every child is offered this vaccine, not a mandate, it's a recommendation, then the insurance company pays for it, it's recommended, and she can elect to have it. By the way, it is safe, there's no side effects, and it's effective. Let's give the mama the ability to give the gift to her child of protection against hepatitis B. She may not know her hepatitis B status, and the doctors may not know. But if they're all offered, it works.
All right. We got to leave it there. It's a recommendation at this point, so we will check and see and track this policy for potential change. Senator Cassidy, great to have you. Thank you.
Thank you, Shannon.
Hey everyone, I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.